I needed to learn to stay calm regardless of how anxious and worked up that my children would get. That was really key. Once you can start reflecting back what they're saying to you, that also helped to helped to calm the situation.
To be honest, in the beginning, I wasn't very good at communicating with my loved one when they were in crisis. That was before I understood how psychosis works and what it does. So I got frustrated with my son's ideas because they didn't seem grounded in reality. I was tired. My patience was worn thin from not sleeping and worrying, and sometimes I tried to get him to see my version of reason. It's not always easy to be able to communicate with the healthcare professionals when you're not the patient. They don't always want to hear from you or talk to you, but I was really fortunate in that my son consented to me communicating with his healthcare team, and they made themselves available and they acted quickly. So I would sometimes email my son's nurse from the early psychosis intervention team, describe medicine side effects or behavior changes. She would speak with the psychiatrist, and often they'd schedule an emergency appointment to address the concerns with my son. It was super helpful.
So strategies that I would use were that I didn't want to argue. I would ask open-ended questions. I would validate things that they were saying, so I would reflect back what they had said to me to make sure that I understood what they were saying. I also learned to speak in very uncomplicated sentences, 5 words or less, so that no matter how excited they were or upset, or it would get through, that it would be something that they would be able to understand.
So how I communicated with loved ones about what was happening with my son during psychosis was that I relied on the policy we always had anyway. Policy in our house has been be open with everyone about everything, including mental health. So it just seemed natural to carry on that way when psychosis arrived. It's an illness, it's not a shortcoming. So any family and close friends who asked got the full scoop. I did find it a little difficult to explain it to people in the outside community. We live in a relatively small town. We've lived in the same neighborhood, for all of my kids' lives. Everybody went to school with everybody, so I'd bump into people at the grocery store, and, all of our kids were university age by then, and they would give me glowing reports about how wonderfully their kids were doing in first year university, and I felt a little sad and uncomfortable. I learned how to get around that, and I just started to keep my sharing shorter with the outside world, and I found out that less is more.